My name is Dr. Marlene Seltzer, and I am the Medical Director of Beaumont Children's Hospital Anti-Bullying Program, NOBLE, or No Bullying Live Empowered. And today I'd like to talk about bullying, both generally and from a healthcare perspective, as well as share some information about the NOBLE program. Bullying is defined as unwanted aggressive behavior with the intent to do harm. It involves a real or perceived power imbalance, and the behavior is repetitive or highly likely to be repeated. Those that are involved in bullying behavior can have the following roles: the victim, sometimes referred to as target; the bully, sometimes referred to as the aggressor or perpetrator; the witness or bystander; or the bully victim, which is, as it sounds, someone who has been both a bully and a victim. And of course, there's other combinations as well, but the bully victim group is the one that's been the most studied. Generally, when we talk about youth being exposed to bully, we try not to define them by their role. So rather than a victim, we would say the person who's being bullied. Or rather than the bully, we would say the one who is bullying somebody else. But in research, those labels are used. So for the purpose of this talk today, I'm going to go ahead and use those terms. There's physical bullying, hurting someone, taking or destroying their belongings; verbal, making disparaging comments, taunting, threatening, or intimidating; social, sometimes referred to indirect or relational, which involves hurting someone's relationships or reputation via gossip, rumor, or exclusion; and of course, cyberbullying. Cyberbullying has really changed the face of bullying because it can occur 24/7. So traditionally, when bullying occurred at school and someone went home, assuming home was a good environment, that was a safe haven. But now someone can go home from school only to receive 100 emails or texts throughout the evening and night. Another difference is that the bully can remain anonymous. And anonymity also emboldens people who might never bully someone face-to-face to go ahead and engage in that sort of behavior. So if someone receives emails and texts throughout the evening, they may go to school the next day wondering if the person sitting next to them in class is the one who sent all those emails. On average, youth have 2 email addresses, many have more. It used to be that they had many more than one Facebook profile, but now they moved on from Facebook to Instagram and Twitter and Snapchat and Ask.fm and Voxer and WhatsApp and Yik Yak and After School. And probably by the time I finish listing those off, 5 more social media apps have been created, uploaded, and youth are already using them. Cyberbullying often gets a lot of attention in the media, and usually it's because it's associated with tragic outcome. One story that always stands out to me is a young woman from Canada who took her life last year. She was being cyberbullied, and she went to the school, and the school couldn't stop it. Her parents couldn't stop it. Law enforcement couldn't stop it. So she moved to another city, but even moving couldn't stop it. So you can imagine in her mind, especially as a teenager, nothing was ever going to stop it. So ultimately she took her life. It's important to realize how early our children are using the internet. A study in 2011 showed that 1/3 of 3 to 5-year-olds are on the internet every day. And by the time most children leave elementary school, they're already on the internet, and most are using it for school or in school. Because of the differences in the way research has been conducted, the reported prevalence of cyberbullying has often varied widely. But the Cyberbullying Research Center has really looked at their data carefully from the past 7 years, where they've surveyed thousands of middle school and high school students. And what they found that approximately 25% had been victims of cyberbullying, and approximately 17% have been perpetrators of cyberbullying. Michigan's high school youth risk behavior survey data from 2013 shows that nearly 1 in 5 high school students in Michigan have been the victims of cyberbullying. The Social Age is a study out of England where they interviewed just over 2,000 youth between 8 and 16 and their parents, and they found that approximately 59% of youth less than 10 were using social media. They found that 52% had ignored Facebook's age limit of 13 when setting up profiles. And there's currently estimated to be 1.4 billion Facebook users. 25% of those Facebook users are less than 10, which translates into 350 million Facebook users that are less than 10 years old. Which is really not surprising, since all around them they see adults using and talking about social media. In fact, by the time youth are 10 years old, they're already starting to talk in text lingo, such as OMG, BFF, LOL, again, what's reflecting what's going on in the world around them and wanting to be part of that world. Traditionally, bullying has been thought to start in elementary school, peak in middle school, and then persist into high school. Although more recent data has shown that bullying behavior can be identified as early as preschool and kindergarten, which would be the ideal time to address it. And unfortunately also persist into higher education and into the workplace. Appearance, including disability and body size, is generally reported to be the most common reason youth are bullied. Obese youth are 63% more likely to be bullied than their normal weight peers. Approximately half of youth with autistic spectrum disorder are bullied. Sexual minority youth are particularly vulnerable to the risks of bullying, as are youth with special health care needs, chronic diseases, learning disabilities, really anything that makes them stand out or appear different. Although not all youth with identifiable risk factors are bullied, many youth have no identifiable risk factors but are bullied, and sometimes it's just because they're a threat to someone's social status. So someone may be higher on the social hierarchy and another person is threatening their position, and they may bully that person just to make sure that their place is kept secure. Sometimes there's competition for romantic interests, and that's a reason that people bully each other as well. During the 2010-2011 school year, schools were required to report bullying incidents to the State Board of Education. During that year, over 8,000 incidents were reported in the Tri-County area. But you can imagine for each of those incidents, at least 3 people were involved: the bully, the target, and a witness, although there was usually more than one witness. So you can imagine those numbers start to add up. In addition, the number itself is likely a gross underreporting, because these are only incidents that were reported to the school administrators, and most incidents fly under the radar of school administration. So best estimates are only 50% are reported. So again, you can see how high those numbers really are. Another pressure, and a reason why the reports may not be accurate, is there's pressure on schools not to report. Because if you're school A and you report truthfully, but school B doesn't report truthfully down the street, then your school A looks worse. So whether school administrators are aware of this pressure or not, unconsciously they may not recognize bullying or report it as such because they don't want to depict their school in a negative light. In Michigan, the most current data we have is from the 2012-2013 year, and approximately 24% of students self-reported being bullied. In December 2011, Michigan became the 48th state to pass anti-bullying legislation, which took effect the following June. Basically, it states that all schools must have a policy, and that policy must prohibit the bullying of any student for any reason. It must prohibit the retaliation against anybody who gives any information about a possible bullying incident. The school must identify an official who is responsible for policy implementation and describe how that policy is to be publicized. There also must be a procedure for notification of the parents of both victims and perpetrators, a procedure for prompt investigation of a reported policy violation or complaint, and then a procedure to document the incidents, and then annually report all verified incidents of bullying and consequences to the district school board. When this policy came out, it was generally considered to be a very good piece of legislation. However, quite honestly, policies are only as good as they're enforced. And although the legislation recommended training for school personnel, it didn't require it, nor did it dictate any specifics. So how this policy is approached really varies quite widely from school to school and from district to district. There have been some recent changes to the Michigan law. At the end of 2014, the governor signed a piece of legislation that added cyberbullying that must be included as a form of bullying that schools prohibit. It was somewhat naive to think that cyberbullying would exist and not invade into the school environment. The legislation also requires that the confidentiality of somebody reporting must be assured. And once again, that schools must annually report bullying to the State Board of Education. The State Department of Education. Another piece of legislation that was signed last year was the establishment of OK, which is a confidential tip line, and this really went into effect at the beginning of this past school year. And OK to say is a way for students to anonymously report behaviors that threaten their safety or the safety of others. It really addresses the students' fear of retaliation by their peers if they report. And so it's designed to empower students as well as parents and school officials, law enforcement, to share and respond to student safety threats. OK to say worked very hard to make sure they have a comprehensive communication system, so tips can be submitted via telephone, text, website, email, and a variety of other modalities. This really rolled out at the beginning of this past school year, and as of December 31st, over 410 tips had been received. 163 involved bullying and cyberbullying. There were 54 threats of suicide, including one that was actively interrupted, and that student was taken to the hospital and saved. There's been reports about self-harming, assault, gun tips, one which did involve a gun that was in the school, sexting, alcohol and drugs, and child abuse. So it's been very successful, and everyone is very excited that as the knowledge about this tip line grows and more people have confidence in it that their anonymity will be preserved, that they will continue to use it. Around the same time Michigan legislation was passed, the American Academy of Pediatrics came out with a technical bulletin that basically talked about the effects of early childhood adversity and toxic stress, basically explaining how advances in science can now help to explain the impact of childhood experiences. Again, basic science is now able to explain what people really have long believed, that traumatic events can have a significant impact on learning, behavior, physical and mental well-being, and that this impact can lead to lifelong impairments. Although the report did not specifically mention bullying, bullying can certainly be considered a childhood adversity, if not toxic stress. In fact, there are many people who feel that we should no longer use the word bullying, that we should use peer abuse, because the consequences of bullying are very similar, if not identical, to other forms of abuse. Really, anyone exposed to bullying is harmed by it, whether that person is a target, whether they're a bystander, or the bully themselves. They're all at increased risk for adverse outcomes. I often refer to bullying as a healthcare imperative. The reason I do is because of the consequences. While bullying may begin at school or now in the cyber world, it often ends in the healthcare arena. And the consequences are both mental and physical. And whether someone is a bully, a victim, a witness, or any combination thereof, they're at risk. And in fact, youth with multiple roles are at the highest risk. PubMed is sort of the Google of medical literature. And this is just to show the explosion of research that's being done by the medical field when it comes to bullying, looking at both the short and long-term impact, different people that are at risk, the consequences of bullying. So our understanding of the impact is really growing. Victims are at risk for depression, anxiety, decreased self-esteem, suicidality, physical symptoms such as headaches, stomach aches, even more frequent colds, pain, and of course their academic performance can be impacted as well. Bullies also are at risk for depression, anxiety, suicidality, substance abuse, physical symptoms such as headache, stomach ache, and delinquent behavior. In fact, research has shown that boys who bully are at increased risk for criminal behavior. The original research, a lot of it was really done just with boys, but more recent research has included girls, and they seem to be just as much at risk. Some of the earlier research revealed that boys who are identified as bullies by age 8 are 6 times more likely to be convicted of a crime by 24. Bullying has been shown to be a marker for more serious violent behaviors, such as weapon carrying, frequent fighting, and fight-related injury, and that data holds for girls as well as boys, although the risk is greater for boys. We know that boys that bully are at increased risk for becoming perpetrators of domestic violence, as well as a number of other poor outcomes. This is a study that came out in August 2013 that looked at a group of children starting when they were 9, 11, and 13. They followed them annually until they were 16, and then they were reassessed when they were 19, 21, and 23. They looked at both youth that were bullied as well as youth that were bullying others, and what they found that both were impacted. When they looked at the risks for youth that were targets or the victims of bullying, they found that those poor outcomes were directly related to the fact that they had been bullied. However, when they looked at the bullies and the fact that they were at risk for poor social, financial outcome as well as criminal behavior, they found that when they looked at known risk factors that children would already be at risk for developing these behaviors or these poor outcomes, they found that the risk didn't persist when it came to bullying. And what the researchers interpreted this to mean is that this behavior was a marker for an antisocial tendency, that it was an indicator rather than a cause, so that children who were bullying were already on this pathway at risk of poor outcome, which just underscores the need that when children are younger we need to pay attention. Of course, the most drastic consequence of bullying is suicide. And this is a document that was produced by the CDC in April of 2014 and given to schools to try and help explain the relationship between bullying and suicide. One of the things that the document underscores, again, that it's not just the victims that are at risk for suicide, the perpetrators are at risk as well. It's currently estimated that approximately 30 to 35 families in Michigan have lost children to suicide, secondary to bullying, although it's probably much higher. And we have no idea the numbers of attempted suicide that occur secondary to bullying. Unfortunately, suicide from bullying has occurred often enough that the term bullycide was coined in 2001, really defined as suicide from excessive bullying. And risk factors are often considered to be relentless bullying, resulting in relentless pain, whether that's mental, emotional, or physical, humiliation as a form of torture and embarrassment, things brought up over and over again. Although I'm mostly speaking today about peer abuse, bullying from an authority figure also puts someone at risk, so if it's a teacher or a coach or another adult in their life, as well as social isolation. In fact, it's been shown that targets, if you even have just one friend, that can be protective. Witnesses are also at risk for many of the similar adverse consequences as victims. One of the theories is that if somebody sees something going on at school that they know is bad, and they feel like they should do something but they don't, what does that do to their self-esteem and their self-worth? If they go home that night and think about, I should have done something but I didn't, how does that make them feel? What does that do to their anxiety level going back to school the next day? Especially if they're afraid that if they say something that they'll become the target. And that fear is a very real fear, because there are unfortunately many circumstances where people do then turn on the person who tries to intervene. It's really important for us to understand that the witnesses are also at risk, because they're the largest group in any setting. But it's also important that we can't ask our children to stand up or to speak out without adults being willing to do that as well. Because again, if they're willing to risk intervening, they need to know that adults are standing behind them and adults are willing to back them up. And so we do want them to speak up and stand out if they feel comfortable. But again, they have to know that the adults in their community are standing right behind them. And then bully victims are always, again, at the highest risk for any sort of mental health consequences. All these adverse outcomes are not without their economic impact. This analysis was done in 2009 when it was given some testimony to Maryland's General Congress when Maryland was looking at some of their anti-bullying legislation. What they estimated was approximately 37,000 students would be impacted, and that translated into $2 million in direct outpatient costs and $59 million in emergency room and inpatient costs. Staggering numbers. Just to underscore that point, a year or so ago I ran into someone that I had used to work with, and I asked her how she was doing, and she'd said it had been a really rough couple of years, but that things were getting better. During the course of our conversation, I found out that her son had been waking up every night, screaming in pain and pulling out his hair, and that nobody could figure out why. One night he woke up screaming in pain, pulling out his hair with uncontrollable vomiting, and they were sure that he had a brain tumor. He was rushed to the emergency room where he underwent a CAT scan and an MRI and a spinal tap, as well as an extensive evaluation, that ultimately all of which was negative. He was just being severely bullied. And so you can see what the impact is and how quickly those costs can add up. And it's a tragic story, but at that point when I saw her, he had been removed from that school and was undergoing counseling and was doing much, much better. But to that day, when he passed a large group of boys, he still physically reacted. This is another study looking at the economic data, or the economic impact, and the cost-benefit analysis. The Winberg Research Institute in Pennsylvania received a large grant, and they were able to implement the Ulvaeus Bullying Prevention Program, which is generally considered to be the gold standard of bullying prevention programs. And they were able to do that in 49 school districts, affecting over 200,000 students. So they looked at the cost of implementation and then the projected impact. And what they found is by year 3, they were projecting to save over $13 million in healthcare savings, over $13 million in school savings, and $1.4 million per student over their lifespan in societal savings. So if bullying is a healthcare imperative, how can healthcare providers be involved? One way they can be engaged is to screen. Screening all youth makes a statement that bullying is a healthcare issue, and it's one that's worthy of our attention. It also provides the opportunity to educate both parents and youth from a different perspective than the education system, as well as provide education and information about resources like hotlines and OK to Say. It also gives healthcare providers the opportunity to reframe how we see bullying behavior, to see it as a red flag and to see it as children needing help. Because the earlier bullying behavior is identified, the earlier we can identify what's driving that behavior and hopefully intervene and not only change the outcome of that child's life, but really everyone they come into contact with. Because a bully at 8 may very well be a bully at 18, may be a bully at 28, in the workplace, and in their intimate relationships. And doctors are often seen as having a child's best interest at heart, so therefore they may be able to explain to patients the risks associated when a child is exhibiting bullying behavior and the need to address that behavior, again from a different standpoint than the education system. When I say that we need to see bullies as needing help, it's not to say that they should not be held accountable for their actions. They should be. But even if you look at juvenile delinquency, recidivism data, positive behavioral intervention has always been more effective than punitive. I'm often asked, why do children bully? Well, it's for a variety of reasons, but most often it always includes a desire for power, often status and attention. They may do it to fit in, so they're part of the crowd so they don't become a target, or they may have been a prior victim and they want to make sure that they don't become a victim again. They may be acting out from stress at home or from other places and don't know how to cope with that stress. They may be modeling behavior that they've seen at home or they've seen in school or other places. They once again might be competing for social standing, just trying to make sure that their position is secure, or they're competing again for the romantic interest of somebody else and want to make sure that they're the one who gets that other person's attention. There's a lot of ways that people try and prevent this type of behavior, and there's been very effective school-based intervention programs. But another thing that's been shown to be helpful is really having a positive, caring relationship with an adult. That's been shown to be a key factor in building resilience. In fact, if you've often talked to people who've overcome really difficult circumstances, they will often say that I had one person who believed in me, whether it was a coach or a neighbor or a relative. There was somebody who really believed that they were going to make it and they were worthwhile, and that can make a significant difference. So relationships with a caring an adult can really mitigate the negative impact for anybody involved in bullying, whether that person is a target, a witness, or the bully themselves. I'd like to share a little bit of information about the Noble program. Its really main purpose is to be a community resource for really anyone in the community who has a need or wants information about bullying. We try and provide education, guidance, and support to youth and parents that are being impacted by bullying, youth and families really. We do program collaboration with other key stakeholders in the community. We actively try and involve healthcare to be involved in this issue, as well as involved in research. One of our collaborations has been the establishment of a hotline that's in partnership with Common Ground, who manages it. There's the ability to call 24 hours a day, as well as to text or instant chat, iChat over in the evening and afternoon hours. We have a bullying issues mediation program in partnership with Oakland Mediation Center, and this is really designed for parents and adults and schools around the issue of bullying. Sometimes as conversations between parents and schools come to an impasse, the school is working on the problems, but the parents aren't satisfied, and very often there's a lot of frustration and people don't know what to do. So rather than doing nothing, feeling like they have to transfer their child to another school, turning to litigation or even to social media, it's a way to bring everyone to the table to try and facilitate a solution that's focused on the child. And what we believe is that if we make it better for one child in a school, we probably make it better for all children. Another collaboration we've done is with Literary Arts, Inside Out Literary Arts Project out of Detroit. For years they have been placing published poets and writers in the school to teach writing and self-expression alongside their English curriculum. We piloted a program, a themed residency, about issues of compassion, empathy, and bullying. And at the end of their program, they put together a book of their poetry as well as have a gala where they read their poems. This was a pilot project from last year with 8th graders in Oak Park. And I love that they named their book, Words Ain't No Walk in the Park. We were able to continue this program and expand it this year, secondary to a grant. Another program that Noble is involved in is Noble ABC, or Anti-Bullying Collective. There are many organizations in this community that are really trying to work on this issue, and many of us came together to try and figure out how we could work together. So what we decided is that we wanted to look at communities and figure out how we could help communities go from bystanders into upstanders, because we all believe that this is a societal problem, not one that's mainly an educational issue. At the same time, we decided to get involved with the community. Farmington Hills was developing an initiative from their students. They're from 4 different high schools. We're all working on things to try and create a better environment. So they came together and we helped support their initiative. They named their group Farmington Empowered, and their motto is, "We are the change." One of their initiatives was to start Purple Outs, which was the first Friday of every month to wear purple to show a visible support for a kind and respectful community. So if any of you are ever in Farmington on the first Friday of the month, please feel free to wear purple to show your support. And this picture is one of the principals at the elementary school from earlier this year. Other things that Noble has done to try and reach out to physicians is we created a PSA to try and encourage them to screen. And I'd just like to share that with you.
Hey, Doc.
Yo, Doc.
Doctor?
Ask me why.
Ask me.
Ask me.
Ask me. I can't sleep.
I get stomach aches.
My head hurts.
I can't think. I can't concentrate. I can't sleep. I can't think. Doctor.
Please.
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 Doctor. Please ask.
I'd like to thank you for watching this today, and to please know if you need any resources, have any questions, that you're feel free to contact the Noble program. For any youth that may be watching this, there's a hotline available, and there's also OK to Say, again, the confidential tip line that should really empower anyone who knows about any act of bullying to go ahead and report it. I should underscore that the people who receive those tips are trained program reporters or program operators. They will then report any tip to the local school and law enforcement, and they will follow it up to ensure that there's accountability to make sure whatever tip has been received has been investigated. So again, thank you for your attention, and please feel free to contact me with any questions.